Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host,
Dr. Riley.
Welcome back, everyone. In today's episode, we really want to dive into the phases of chiropractic care. And we actually, over the years, chiropractic has been, has become well known for the different phases of care, when you're talking about chiropractic. And there's been different names for those phases, but we really want to incorporate it as the 3 C's of chiropractic phases of care, and really kind of discuss where a lot of our patients maybe start care at, but ultimately where our vision, we always talk about becoming the best advocates, your best self-advocate, and health, your very own health advocate. So, we want to talk about, what we can do to, really help kind of maybe the understanding of where you're starting with care, but ultimately where you'd like yourself and, family members to get to. So, as with everything, we talk about on the show, anything none of this information should be used for, diagnosing or treating anything. Always talk to your trusted healthcare provider. But with that being said, that little disclaimer, we're going to just go ahead and dive into the phases of care. So, first one, Dr. Riley, and you can tell me, this is where I believe the majority of our patients come in at, okay, is our condition. That's the first C, our condition phase of care. And so why don't you take a minute, from your perspective, being in practice about a year now, what does that mean to you, and what do you see on a daily basis?
Yeah, based on, the condition, or that they're like, anything to help me just get this pain away from me. Yeah. That's kind of where they're at, whether it be, they've heard about chiropractic care, they understand, the philosophy of it, and they're like, okay, this symptom X showed up. If I get care early, when this showed up, hopefully I can get out of this, acute, I'm in a lot of pain. Or, the people can come in, they're like, I've had this reoccurring for X amount of time. I go get a medication or, PT, and I get this to go away, but then boom, it comes back just as hard. So I kind of like that condition based, okay, get me out of this pain. Yeah,
they're kind of stuck in this yo-yo cycle of like, they'll feel a little bit better, and then they, fall back down because they stopped doing the things that were helping. And and I think that's, there's a number of reasons that those conditions can come about, right? And when we talk about healthcare conditions, we're going to focus, I think, a little bit more on like the aches and pains that people come in with, but certainly chronic disease, insulin resistance, type 2 diabetes, low energy, chronic fatigue syndrome,
digestion,
indigestion, bloating, constipation, diarrhea, breathing challenges like, asthma, allergies, chronic sinus conditions. Like, a lot of these things can be linked to dysfunctions going on in the system. But, the easiest way to look at it is, hey, I woke up, I bent over to tie my shoes and my low back flared up, or, I was bending over in my closet and I sneezed and now, I can't, turn my head, or I slept funny on my pillow and I can't turn my head in traffic. So, or I have a headache coming on. I've been sitting at my desk all day at work and I've got this, massive headache. So a lot of times it's the conditions that are, it's the pain, right? The ache or the pain that's driving someone to do something. Only 2 motivators in life. You know what those are, right?
What are they?
Pain and pleasure. Okay. And which one's more motivating?
I would assume pain.
It's extreme. It's 10 times. It's 10 times more motivating. pain is a 10 times better motivator than pleasure. So again, we are designed that we either seek pleasure or we run away from pain. So that's where, again, most people wait until, the pain, which is the alarm bell, the signal going off to go do something about it. But because pain is such a strong motivator, they'll hang around, they'll start to feel better. And if the pain goes away, then what happens?
Yeah.
They quit, right? They stop care. And again, a lot of times what happens, we see, these very acute conditions that, that show up. And again, when we talk about acute, the pain is acute, right? Like that may have just shown up, but we could take an x-ray and see that, they have significant degeneration from like a sports injury or a fall in their childhood or, whatever the case may be. Like, we can see a, 20-year history, especially if the person's in their 30s or 40s, we can see a 20-year history of breakdown, in their spine that shows this problem has been developing. Well, they just woke up with the pain maybe that week or, that month. But, that the problem, the underlying reason the problem showed up in the first place is that the spine has been slowly, degenerating and progressing down this, path of getting weak over the past, 20, 30 years.
Yeah.
So when we talk about the acuteness of the pain, it's like, okay, well, maybe the pain showed up in the last couple of weeks, the last month. And then they start care, they get a couple of adjustments. And we see this all the time, right? You start care, you get a couple of adjustments. And I'd say the average person within 3 to 6 visits is probably feeling significantly better from, whatever they came in with, whether it was headaches or shoulder pain or, sciatica, low back stiffness, tightness, whatever the condition was that drove them in, within 3 to 6 visits, within a couple of weeks, they're feeling significantly better. So then if we take that to, the pain, the pain being the motivator, well, now the pain is starting to be removed, right? So now the motivation of, continuing down the path of ongoing care has been removed. And so now we want to, so now a lot of people will drop off after that condition starts to resolve. And Dr. Pierce, because we practice the Pierce results system, Dr. Pierce talked about that in terms of when you have someone, a patient that walks into your office and they have an acute pain, regardless of, what modality they decide to do, whether it's a physical therapist, whether they go to their medical doctor and get pain medication, whether they take an over-the-counter pain medication, whether they, go to the chiropractor, go to the dentist, whoever they seek treatment for, 60% of those acute pains that show up are self-resolving within a couple of weeks. Yeah. Okay. And so most of the time the person is going to give credit to whoever they see, in that initial time frame. Okay. But then what we were talking about right before we jumped on, what happens is, and you actually mentioned it right at the beginning, is this cycle, right? Because if they stop the care or the intervention or whatever they're doing, and you're not getting to the underlying issue, what happens?
It's going to keep that coming back.
Yeah, it keeps coming back. So now we move from, this acute condition, this pain that showed up because the underlying reason is not getting corrected. Yep. Now we move more from an acute to a chronic condition. Yeah. And again, chronic disease we know is at the forefront of our, of our sick care society, right? Yeah. 90% of, health symptoms and health challenges that people suffer from are chronic disease, right? Because it's been there for a long time. So, and a lot of that can be traced back to, early
injuries, early.
Yeah. Yeah. I mean, you did sports your whole life, right? So do you, do you experience some of that, now in terms of you're creeping up on 30 or you're not there yet, but you're creeping up on that, some of the stuff that you experienced in your, high school, college days and adolescent days, in terms of what you can or can't do now or recovery or.
I think, I got out of a lot of the contact sports relatively early, which was good. Like football, I stopped freshman year, and I think that kind of helped a little bit with some of the injuries I think I could have faced. But I know my freshman year of high school, separated and dislocated the right shoulder, And even when we were trying to figure out that testing stuff, like my right shoulder
didn't move.
is not much of a mover. So I'm I'm fortunate to have that really as my one residual from injuries, but I'm sure if I wasn't under care, I'd be hurting a lot more than what I do.
Yeah, and there's still room for improvement, right?
Oh, yeah.
So, and I think that's what we're trying to get to, the understanding of this condition-based care. Our entire healthcare system. We always talk about sick care, right? The sick care disease system. Our entire system is built around pain and feeling. How are you feeling? And if you're not feeling optimally, well, that's when there's a problem.
Yeah.
And if you are feeling okay, then you're probably okay. You're probably good, right?
Yeah.
But the challenge that we always talk about is, how many of us know someone that was completely fine, one day, they were out on the golf course or they were working out in the gym, and then the next day, like, boom, they die in their sleep.
Yeah.
And, unfortunately, that is such a common occurrence that we hear of. And it's like, well, if, whether it was a heart attack or a stroke or whatever the case may have been, there was obviously some underlying condition that led up to, that death being the first, major sign of illness. So the reason we talk about, pain is a great indicator that there's something going on, but it's not necessarily the only indicator that something could be developing and progressing. And that's when we talk about subluxation in the office, that's the term we use for spinal misalignment and or motion restriction, that's impacting the nervous system. So if you have a spinal subluxation, a lot of times, especially if they happen in childhood, there's no pain associated with it. Mm-hmm. But now you move from a subluxation that maybe happened from a slip or a fall, when they're learning how to walk or crawl, fall off of a bike or, down a step, or, they're sitting in their car seat funny and they fall asleep like this for, 3 hours in a car trip. Yep. You have all of these things in childhood that could lead to a spinal subluxation. No pain associated with it. But now their spine, if you don't take that child to the chiropractor, now their spine develops with this subluxation and it starts to mature with this subluxation. So now this acute subluxation that could have been corrected relatively easily in childhood, now the body starts accepting it as a chronic long-term compensation. Yeah. So, now you move into from an acute ailment or ache or pain to more of a chronic, condition. And like you said before, it's like, it's much more than just, your aches, your pains, your headaches or, tingling and numbness. This has to do with internal body function, your breathing, your digestion, your immune system, your muscle recovery. All of that is interconnected to your nervous system. So if you have this chronic subluxation, that is not taken care of from an early age, now your condition, based care is really looking at, if you want to correct the underlying issue and actually stabilize and strengthen the spine, now we need to move out of condition-based care to where you're feeling better in a couple visits to actually correcting the underlying problem, which is the inherent weakness of the long-term subluxation, the restriction, misalignment of the spine that's been there for a long period of time. And as you see, right, the longer it's been there, does it take longer or shorter to correct?
Way longer.
Yeah. So the longer it's there, then the harder it is to correct long term. This is why we're such advocates, right, for seeing kids. You've gotten pretty comfortable, seeing a lot of young ones in the office. What's been your experience with that recently?
A little goes a long way for them. Like, we do the thermography scans to kind of see, if they've got a good bit of nerve dysfunction, and they have the bigger, I think, pre-post changes compared to, when you have those chronic conditions. And so, we'll have the kids come in and, they had a fall or they fell off their bike and stuff like that. And you can easily see like, okay, this is the result compared to last time. So you get that adjusted and, they're pretty good within one or two adjustments, which is, it's nice. It's rewarding too, because chasing that for X amount of time like you would with a chronic condition.
And that's such a good point. So just like, where adults can be a lot slower to move from condition-based care to actually correcting the problem, kids very quickly can, again, they don't necessarily have an ache or a pain that they're suffering with, but their parents are bringing them in because their parents have seen the effects of, the positive effects of them getting adjusted. So now they bring kids in. And so now kids, within a couple adjustments are actually, they're not even starting care in the condition based, they're in the corrective. And that's the second C, by the way, which I didn't mention before, but your corrective care. Kids now are corrected within a couple visits, in terms of, getting that subluxation, removed or lessened. And we're actually seeing neurological change like that. So that kids adapt so quickly that they can go from a very stressful scan to a very healthy adapted scan very quickly within a couple visits. Whereas adults, as you mentioned, if it's been there for a long period of time, again, the pain may have only showed up, in the last couple of weeks or a month, but we take an x-ray and we're like, you had an accident or a sports injury or something, 20, 30 years ago. And this has not been taken care of very well. And again, maybe they've always, just, I've always had stiffness, or I've always had, this upper back, or I've always had these headaches. And, and again, like when it's flared up, maybe they go to their medical doctor, maybe they take some over-the-counter medication, maybe they go see a physical therapist for, a couple visits, a couple weeks. And then it's like, all right, they're feeling a little bit better. And then boom, they stop what they're doing. But they never get to the actual corrective, stabilizing it and strengthening, the actual spine and areas around it, to truly make a correction. But Jerry, do you have a story with like some kids that you've worked with? Because I know you've seen so many in the office recently. A lot of young moms bringing babies in, and you have a story that is top of mind recently.
One of our patients brought her. I think her daughter's the same, like 2 weeks, I think, younger than Madeline, my baby, and she was having some like crawling issues. She was still crawling, but she would almost drag her left leg while she was crawling, and that was her only issue. She was sleeping pretty good, eating well, sitting up, just
and even starting to stand up a little bit. But her parents were really concerned about that cross crawl,
and so we did the DTG, another thermography scan that we do on children, and she's 8 months old, so I'm running the scan up and checking her temperature in the neck, all of that, it's all within the normal that we want. And so the last thing we do is we check the glute folds, and I saw a little bit of deviation there, so I just I did a little bit of work on her sacrum, and I don't think I saw her back for 2 or 3 weeks. And so mom comes back in with her. I was like, how's everything going? And crawling perfectly fine now. No leg lag or anything with the crawling. So just that one adjustment on an 8-month-old made a huge difference, and so that was pretty cool. And then seeing another kid.
Let's pause that for a second. I know Dr. Riley gets a little excited sometimes, but seriously, like because think about that. So if you're not developing that cross crawl, we talk about not just from a muscular strengthening standpoint, and development from a, musculoskeletal standpoint, but also neurologically, that cross crawl motion, from, arms and legs, to then, hopefully getting beyond that into the walking, the bipedal walking, left, right. That stimulation is integral to healthy brain function. And so let's assume that wasn't corrected. Okay. So let's go down the path of, that leg wasn't corrected. And again, it was a tailbone. You said it was a sacral deviation. And something we see very, very commonly in kids, because even when they start to sit up, if they start to like lean one way, or again, they stand up, they pull themselves up and then fall flat on their butt. Well, it's like the tailbone in a triangle. If it hits a little bit one way or another, you can literally knock it, out of alignment, and then the muscles all seize up. So not only do you have a misalignment, but now a motion restriction at that tailbone, which should be pretty mobile, as a young infant, going into a young toddler phase. So let's say that wasn't corrected and that leg continued to stay restricted. And, the child, again, our bodies have the incredible ability to adapt.
Mm-hmm.
But now they start crawling and the one leg is just dragging behind, and they never fully develop that musculature of that leg, at least not symmetrically left to right. And that's also impacting healthy neurological function.
Yeah.
And messages, coming back to the brain and then back out. There's a concept called garbage in, garbage out,
Mm-hmm.
right? That's, when you have imbalances of the information being up to the brain, then our output in terms of muscular, reflexes and postural reflexes are very poor. So then you're more injury prone. So if that wasn't corrected, now you could have a child who, going from 1 year, and maybe they, because again, they could do all this without having any aches or pains, but maybe there's just a little bit of a rotation in or out. But now, they hit 20, 25, 22 years old. And now all of a sudden, because there's this torque or twist or tilt in this tailbone, which has a ton of neurological connection to, reproductive organs in that area, nerves going down the legs, maybe they're, in their early 20s, now they're developing significant, like menstrual dysfunction.
Mm-hmm.
Maybe that young woman is starting to look at, raising a family, and now spouse and her and her spouse are having difficulties mentally, emotionally from the impacts of menstrual dysfunction. And again, I understand this is a story of just like a potential story, but we see that all the time where it's like patients come in their 20s or 30s and we can relate back to a possible, difficult birth. Maybe their mom had a difficult birth, and so their leg was tucked funny, in the birth canal, and maybe they were a breech birth. Maybe they, there was a lot of force on the head and the neck, in the birth process. And again, we talk about everything that happens after that. So again, we're just giving you the potential, but your correction of that and that leg starting to move has an astronomical exponential ability to allow that baby to develop extremely healthfully. And I mean, and doing that for a kid is just such a rewarding experience as a healthcare practitioner, because one of the things I always say is like, we're never going to know all the things that we may have prevented, until maybe one day we're up in heaven and we just, get a nice little outlook. And I don't know if that's the case, who knows, but yeah, it's like, we never know in this lifetime what was prevented by allowing healthy neurospinal development, especially in these young kids. So yeah, we had that, condition now in that corrective. We're such a big fan of getting kids corrected at a young age, because then their timeline of care and how many adjustments they need is significantly reduced versus the adult who comes in with the ache or the pain in the neck, who's in their 20s or 30s. And that can be traced back to an injury in their, adolescence or young childhood. And now, they're moving from getting out of pain and the condition-based care to actually correcting the problem. Goes from a couple visits to now several months of actually stabilizing and strengthening. So did I say that? Did I say that well enough?
Yeah.
So that's where, again, moving from that condition-based to corrective care, I think has a lot to do with where you start care, in your health journey. If you, and again, if you've never experienced, regular chiropractic care, we're going to get into this in a minute in the last phase of care, but like, if you've never experienced chiropractic care, we talk about this all the time. Like, I just function better, right? Like, I work out a lot, we adjust a lot. So it's like, if that neck starts to tighten up, not only does that impact, mental clarity, but energy level, everything is impacted when your spine is not moving at its optimal range. And so that's what we're analyzing all the time, is we're analyzing, is that spine moving and aligned as well as it could be? And is that nervous system, acting and functioning as well as it could be? And so now we're allowing the opportunity for optimal level of health.
Yeah.
So we're very, very popular in the corrective, right? We get a lot of people in condition-based care, and they a lot of people, they understand after we show the x-rays, right? How long the problem may have been there, even though the pain may have just showed up. It could have been there for, 2 decades or more.
Yeah.
So now they're committed to actually doing some correction to where we actually see pre-post changes on their x-rays, and see their thermography and their nervous system starting to wake up. And then this is where a lot of people, I think, I think a lot of our patients see the value in the long term and the longevity of checking in regularly, because we start to move now. I hate the term maintenance, right? And I think we've talked about this before.
Yeah.
It just sounds so much like a machine, right?
Yeah.
This idea of maintenance is like, we're going to keep you where you're at and hopefully not allow you to break down, right?
Yeah.
Did you have something?
No.
Okay. This idea that like, you're as good as you're going to get, and we want to prevent it from backsliding or breaking down, which again, kind of, to me, puts the glass ceiling on
you have a marker that you want to stay at.
Yeah. And again, and that marker is the ceiling, meaning you can only go down from there.
Exactly.
And I hate that understanding, because that means like, even as we age, people are like, oh, they're golden, or their peak years, right? Mm-hmm. And it's like, oh, it's all downhill after, 25, 30. I hear people in their 30s say like, oh, I must just be getting older. And it's like, oh my gosh. Like, that just drives me crazy. Like, as I'm approaching, I've got a couple months left in my 30s. But it's like, as I approach, like there are days when I'm like, oh yeah, I'm feeling it. But like, I'd say more often than not, I'm like, I'm getting stronger. My mental health and my emotional health is getting stronger. And I'm just so excited to be able to help and bring that to other people.
Yeah.
And that's where we move, I think, beyond that corrective care, and beyond maintenance, because I actually think maintenance, a lot of chiropractors, they say, oh, maintenance wellness, and like, that's their final phase. Yeah. But I actually think maintenance is more in the corrective phase, because once you've corrected it, right, you want to do everything you can to maintain the correction.
Yeah.
And you don't want it to slip back. And we talk about, giving people, strategies and exercises not to recreate the problem that they came in with. But I think that's still part of the correction phase, because you make the correction, and then you want to keep that correction as long as possible.
Yeah.
But where I think we missed the boat is the final C. I think a lot of people, I think we're dedicated to it. We see a lot of family members and, individuals and families who love this idea of conscious care. And this idea of conscious care, first of all, there was a study done probably close to a decade ago now, where they actually did the long. Are you familiar with this study, the serum thiol study? So serum thiol is a marker in the bloodstream that has to do with DNA repair. Okay, and so what they found, and it tends to be a good marker for longevity. And what they saw was, people, there was a broad study done on people who just did condition and maybe corrective care. So they were only, doing chiropractic for, a couple weeks or months, versus those who did chiropractic care for 5 years or more. And they saw that the people who were with a chiropractor and, and I forget what the frequency was. I think it was maybe once a month at a minimum. But they were with a active chiropractic care for 5 years or more. Their serum thiol levels were higher, statistically higher than those who, did not do chiropractic care for that length of time, or didn't have any chiropractic care. So again, from a longevity standpoint, there are markers, both hormonally and chemically, that the body are starting to activate being under long-term chiropractic care. So we get into this concept of conscious care, adaptation, body awareness, performance, trying to, train. Like, you've done some training, right?
Mm-hmm.
I mean, you like to, compete in different events. So talk about some of your training, leading up to, some of the events that you do.
Like the Tour de Donut.
I knew you were going to mention that.
There's a cycling thing that I do every August. It's called the Tour de Donut. And it's, I think, just shy of 40 miles and 3 stations.
Individually, right? Or as a team?
No, individually.
You do 40 miles.
You sign up as a team, but everybody does the same length. And, you have 3 stations where you try and eat as many donuts as you can. And so, performing with that, I get, I think I'm at a good point of health to where, I'm definitely past that maintenance. Like, I don't want to just train, 20 or 30 miles. Like, I want to be able to go 40. And then even when I hit that 40 marker, I want to be able to have the ability to go 50 or 60 miles. Cause if I hit that 40, it's like, there's no purpose to continue after that. But I think that could tie back to health of like, you hit that conscious care, you don't want to go back to that maintenance care. And we talked about this before we even started the podcast of like, maintenance is trying to prevent the injury you came in for, whereas like corrective or conscious would be, preventing some of those issues from starting again, going back to that acute phase. So, even going back to that training, it's like, I don't want to just train for a certain marker. Like who knows what it's going to throw at me. I want to be able to continue if needed. Well,
and again, we talk about that adaptation, right? So if we're talking about it strictly from a spinal health perspective, like, the awareness comes into play of like, well, how am I sitting? Even right now, or like, if you're at work for, 8-10 hours a day, am I taking breaks? Am I starting to lean too far forward and, kink my neck to the side, or am I on the phone all day long? Like, so that's the awareness perspective that I think with the long-term conscious care, it brings that awareness to the table. The adaptation comes into play when, let's say you're walking down the sidewalk or, walking out of a grocery store and you step off a curb. How many times have we seen a patient come in and it's like, oh, I stepped off the curb funny. And, my whole spine just kind of like, you just jolted, right? You just feel that whole, system kind of seize up. Because it's an impact to your system. And it's like the adaptiveness of long-term care is that your body becomes more adaptable. And maybe you get a little bit of a jolt or it seizes up, but that's much different. Being able to work your way through that with 1 or 2 visits because you've been under long-term care and your spine is moving and is adaptable, versus the person who is, maybe using a little bit of a cane, or, they've been walking with a limp their whole life because they've had a childhood injury that was never corrected. And so now they step off a curb and not only do they jolt, but they actually tumble and fall down because they can't handle the quick change of environmental circumstance. And that's when we talk about adaptation, we talk about really that cushion of, being able to handle those changes, whether they're quick or slow changes over time. Your ability to adapt, I think, is the simplest definition of health. Okay. Healing is adaptation, right? We start walking upstairs, our heart rate goes up. We go outside on a cold day, start to shiver a little bit. We eat something, eat a donut, cycle the donut, and man, that blood sugar goes up. But then the insulin comes out, and hopefully you're not insulin resistant to type 2 diabetes, and now the blood sugar comes back down. And all of that is regulated automatically through our nervous system. And the better our nervous system can function, then the better our adaptation is, and the healthier we are. It's same thing with like, and that's just, those examples are physical health. Like, think about it from like a mental, emotional health. Let's say that a family member dies. We recently had a very close family member who passed away. And, I consider myself to have a pretty strong mental, emotional health because I do a lot of things to encourage and support that, so that when you do have the tragedy in your life, which no one's going to get out of life without tragedy, right? It's, we will suffer in this lifetime. No one's getting out without suffering. But it's how you respond to that. So if you have that strong mental, emotional fortitude, then you get hit with, a really, tough diagnosis. We just had patients that came in and, had a really difficult Alzheimer's diagnosis from a spouse. Your family member dies. Child leaving, going out of the house and, growing up. I mean, it's, I don't want to say that's suffering or tragedy, but that's a massive change in your life. And the more mentally emotional fortitude that you have, the more ability you have to adapt from one circumstance to the next. Financially, it's the same thing. The person who is, a very wealthy, millionaire and has a lot of cash reserve, they could have a, really bad month in the stock market, or a really bad, month, or maybe even lose their job and be okay, for, several months, because they talk about one of the best things to do from a financial wellness perspective is to have that 3 to 6 months of, living savings, in an account, so that if anything ever major happens, you have that wherewithal versus the person who lives paycheck to paycheck. They lose a job, they could be getting evicted in 2 months, So that's again, a financial adaptation. Yeah. And so all of this wraps around to the more adaptability that you have, the healthier you are in every area of your life. And that's where, I think the consciousness, the conscious care, the more adaptable you are, especially from a neurological perspective, the better ability you are able to perform. We talk about perform in life in general, whether it's being a good colleague, your wife is a nurse, being a good employee, being a good spouse, being a good parent, being a good teacher, whether you are in fact a trained teacher or you're just a teacher of, people in your neighborhood, your community. Like, we're all teachers, we're all students, and we're all teachers in some way. So the better ability you are able to show up for your life every day. And that's the conscious level of care that, again, that ongoing, adjustment and checking in and making sure that nervous system is, consciously and creatively adapting, that we have the ability to, really, like we talk about, get healthy and stay healthy for that lifetime. So I talked a lot. Did you have anything else to add to that? I apologize.
No, you're fine. It's a good, like you said, teaching and learning. It's learning for me too, but like the conscious, I think that's a great word for that final little bit of care that people should be under, is like, they should be thinking, they should be conscious about what they're doing and how that could affect future them. So it's like, I had this night partying, or I didn't feel like I recovered well from a harder exercise. It's like, okay, how is this affecting me? What's going on? Like, I should probably get checked and see how, my adaptability is altered and stuff like that. Or, just being conscious of, okay, if I do X, how is that going to affect me later? Yeah. So I think that's a great name for it.
Yeah. And predictive too, right? You become, we talked about that at a meeting last week, right? Your ability, and that it goes hand in hand with awareness, but like, the more aware you are, the more you're able to predict what is the outcome. Yeah. And, so it's like, I'm going to go out and have a couple drinks with some friends tonight. So if I wake up and feel a little dehydrated or, a little bit of a headache, it's like, I know why, so you're not rushing then, again, people who are stuck in that condition-based care, and it's like, oh, I have a headache. And, maybe they're aware enough that it's like, I had a couple of drinks, but like, what do? They reach to the medication to mask that headache. And again, one medication, in a day, no big deal. Yeah. One medication, or two medications, or, 3 or 4 pills a day for a year, for 5 years, for a decade. Now you're starting to see the toxic effects of masking, your body's, adaptation and, and prediction and performance. So, so again, we're all about enhancing that performance through better neurological function. And we do that by way of helping the spine move and align better. So, So hopefully that was helpful. If you're ever, not sure of like what phase of care you're in to our current patients, or, if you've tried chiropractic before, but it's been very conditionally based, maybe you're looking for a chiropractor, whether it's, with us or, with someone, in your area, if you're listening to us outside the greater Pittsburgh area, but, maybe trying to find a chiropractor that does more of a corrective approach and beyond to really help you dial in, a healthier life. We are happy to maybe to help you out. So if any of this resonated with you, don't hesitate to reach out. We always have our connection information in the description section. So anything else to add?
No, I think it was good.
All right. So 3 phases of care: condition, corrective, and conscious. Figure out where you're at and figure out what goals you have moving forward. We'll see you at the next podcast. Thanks for stopping by.
Yep. Thanks for listening.
You've been listening to another episode of What the Health? The podcast where anything health is fair game, with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.chirofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"